Hello, welcome to the Grow Your Wealthy Mindset podcast, where it is all about helping amazing physicians just like you create a wealthy life free from burnout and with the financial security to practice medicine on your own terms. I'm your host, Dr. Elisa Zhang. Hello, and welcome back to the Grow Your Wealthy Mindset podcast. Today, I'm going to talk about my personal work situation, which has been in flux of late. For most physicians, our job is initially our primary source of income. It's investing this income that allows us to build more monetary wealth so that eventually our wealth can provide us income and we no longer require a job. When we look for a job as physicians, we often look at job postings or talk to recruiters to see what's available. If we have a specific location in mind where we want to practice, we may talk to several employers in that location, going to private practice clinics or hospitals or healthcare systems. We tend to look for an open position instead of thinking about how we can create a job situation that works for us, or that there may be someone who would be open to creating a position. When I was in fellowship, I certainly fell into this ideology. I looked at job postings, talked to recruiters, and visited practices in my hometown of Cleveland, Ohio to see if anyone might be interested in hiring. Over the years, I've learned the value of reaching out and talking to people. You never know who may be interested or know someone else who would be interested. There are potential jobs out there that aren't really posted anywhere. There's a saying in the business world that your network is your net worth, and that connections create opportunities. There's no perfect job out there. There's always going to be something that could be better or that you wish you could change. But if you find yourself in a situation that really isn't working for you, it can be worthwhile to be open and flexible about trying a different situation. Decide on the aspects that are most important to you, whether that's compensation, flexibility, location, whatever it is, and then consider what you're willing to trade off. For example, I personally love to travel and want to take off more than the typical 4 to 6 weeks of vacation a year that I found have typically been offered when I've had job offers. From talking to other physicians, the amount of vacation can vary greatly depending on specialty and culture at the workplace. I know there are some physicians who work full-time but get up to 12 weeks of PTO. Generally, their compensation is tied to their productivity or collections, and somehow they're in situations where the office staffing may be flexible enough to make this possible. Of course, I can imagine some specialties have a lot less need for office staffing. For example, a radiologist that reads films doesn't have a need for techs for workup or MAs or nurses. For me, as an ophthalmologist and oculoplastic surgeon, I do have a lot of staffing needs in terms of techs, potentially scribes, front desk staff, the typical kind of staff you need for an outpatient practice. I personally decided to go part-time in 2021, partially to give me more bandwidth to work on my coaching business at that time. I started traveling for work in 2022, working a week at a time, typically 2 weeks a month or roughly every other week. I worked for 2 years flying to Central Illinois and have worked the past year in Sioux Falls, South Dakota. Some people are familiar with what's called locums work. Locum tenens is a Latin term meaning one who holds the place for another, and has traditionally been thought of as a temporary position. A person may work a locums position for someone who's on long-term leave for some reason, or while an employer is looking for someone to fill a position permanently. Locums work can be used to cover staffing shortages, as well as to support underserved communities. With medicine becoming more specialized, locums can be a way to have a specialist in a community that wouldn't otherwise have a population to sustain a full-time practice for a subspecialist, but could really use that specialist in a part-time capacity. There are many specialties that frequently employ locum tenens physicians. Hospitalists can help hospitals manage fluctuating patient volumes that could be even seasonally related. Surgeons ranging from general surgery, orthopedic surgery, urology, neurosurgery, and trauma surgery are often needed in more rural areas. Anesthesia is in high demand to prevent cancellation of surgeries for other surgeons. Overall, we face a physician shortage with an aging population and physicians leaving medicine or cutting back due to burnout, which is now affecting up to 60% or more of physicians. While there are locum tenens positions I see for ophthalmology, I've only ever seen one listing for a locum tenens oculoplastic surgeon. And yet, I've spent my last 3 years working like a locums doctor. I say like a locums doctor because I did not work through a locums company and was not an independent contractor. In both cases, I was hired as a W-2 employee and negotiated directly with my employer for the terms of my contract. I also do some locums work through Weatherby, one of the large locums companies that place physicians. So I am able to compare the difference of working directly with an employer compared to working with a locums company. When working through a locums company, you are negotiating through the locums agent you work with and not directly with wherever you're actually working. You have a contract with the locums agency, and the locums agency has a contract with the hospital or clinic where you are actually working. The locums agency is getting a cut for acting as intermediary, and that could potentially be a very large cut. For example, and I'm going to use totally made up numbers here since I really don't know what the numbers are. There's really not much transparency when it comes to all of this. Let's say a hospital pays a locums company $10,000 a day for 24 hours of trauma coverage. The locums company will then try to find a trauma surgeon who's willing to work less than $10,000 a day, including the expenses of covering malpractice and travel for that physician. They may offer a trauma surgeon $5,000 a day in compensation plus expenses, and the locum agency gets to keep the difference between what the hospital pays them and what they pay the locums physician. If they can find someone who's willing to work for $4,000 a day, then the locums agency pockets more money. It's good to know this because when you work through a locums agent, don't just take what's accepted, really try to negotiate for the most that you can get. And honestly, that's really true for any work situation in general. It's also possible that a hospital or practice may have a different type of contract with a locums agency, where the locums agency is acting as an intermediary between the physician and the hospital or employer, for which they may be paid a flat fee for every day the locums agency provides coverage or for every physician that they place. Hospitals may work with one locums agency to fill a specific position or may work with multiple locums agencies. It's not completely transparent how all of this works. Generally, the locums company will provide malpractice coverage, help with credentialing, and assist with arranging travel. When you contract directly with an employer, anything you negotiate is possible. You can negotiate to be paid as a 1099 contractor or a W-2 employee. You can negotiate the terms of malpractice insurance, for which I highly advise you make sure that any tail insurance is covered. You negotiate compensation, work schedule, and any other benefits that may be important to you. You can negotiate for a housing stipend versus reimbursement for the costs you actually incur for staying somewhere like a hotel. While I doubt any locums contract through a locums agency would offer funds for CME, that is something that you can negotiate when you're talking directly to your future employer. I was open to the idea of traveling for work after talking to a recruiter. The practice had a full-time oculoplastic specialist who had left in 2019 for family reasons. They've been having a hard time finding other oculoplastic surgeon, and at the time I talked to the recruiter, they did have an oculoplastic surgeon who traveled from Florida and worked roughly every other week. I ended up joining this practice and working every other week, essentially job sharing with the oculoplastic surgeon who was already working there. Logistically, I flew in Sunday evening and flew home on Friday, working Monday through Thursday. If I could get OR time on Friday morning, then I would operate Friday morning and then fly out Friday afternoon. The practice paid for my travel expenses, including my rental car, hotel, and food. I was a W-2 employee, and they covered my malpractice insurance, including tail insurance coverage. I was also able to contribute to a 401k and negotiated for CME funds. I had wonderful staff and really enjoyed working there. I was busy doing oculoplastics and only oculoplastics, which was terrific. Previously, I had been doing comprehensive ophthalmology as well as oculoplastics. Unfortunately, the other oculoplastic surgeon had a change in his situation and ended up leaving, despite his actually enjoying working there as well. I inherited a lot of patients that he had seen and had scheduled for surgery, and my waitlist to surgery stretched out to over 9 months. The practice asked me to come full time, including moving to Central Illinois. Despite the great job, I declined because my values are really that I'm not going to move from my home and move my husband from his work situation. And in the end, they decided to phase out offering oculoplastics as part of their practice. I was able to stay until I could do surgery for every patient I had already seen as a surgical consult and ended up leaving after being there for 2 years. Since I actually really enjoyed that situation, I looked for another similar situation and was able to get two offers that involved traveling for work in a similar way. I ended up in Sioux Falls, South Dakota, where I worked 2 weeks a month. The practice offered to rent and furnish me an apartment as they thought this would be more comfortable than me staying in a hotel. This led to my having a lovely one-bedroom apartment in a luxury complex that had a nice gym, a pool, a hot tub, and even had massage chairs. This actually cost more than it would have cost for me just to stay at a hotel. The practice arranged for me to drive a company car, as they did have several company cars, which staff would use to drive to their various satellite clinics. I was also reimbursed for my flights, as well as my food, and negotiated for a CME stipend. At this second job, I was not eligible to participate in the retirement plan, but I wasn't concerned since I do have my own solo 401k that I can contribute to. Sadly, I was given notice prior to my 1 year anniversary with the practice, essentially coinciding with the end of my apartment lease. The only information I was offered was that this was a business decision and was not personal or had anything to do with me. Honestly, it was really a shock when this happened. I didn't have any inclination that they had any thoughts of letting me go. And it was a shock to the practice manager as well as to one of the other physicians I talked to who was an associate on partnership track, but not yet a partner. In the end, I think that they probably just didn't have as much oculoplastics volume as they thought they did, as their longtime oculoplastic surgeon had been booking out for months. But since I was there, I kind of taken care of the backlog, and I think I was just no longer really needed. If you are considering traveling for work, I think it is likely that you are more vulnerable to being let go for no fault. Healthcare is a business, and while being a physician used to be viewed as a safe and secure job, I think COVID taught a lot of us just how insecure our jobs as physicians actually are. Every work contract I've ever had allowed for either the employer or employee to terminate the contract with either 60 or 90-day notice for no reason at all. With the current locums work I do, the time frame is even shorter with a 30-day notice to cancel any work shifts. Though I have no data to support it, I think it's more likely that a traveling physician will be let go compared to a full-time associate on a partnership track, or even potentially a part-time associate that lives in the area. Being part-time, I was never on partnership track at either of the practices I worked at. Since even physicians in high-demand specialties often take 3 or more months to find a new position, and it can take 2 months or more to get credentialed and on insurance plans, having an emergency fund to cover expenses in case of unexpected job loss for 6 to 12 months really does help provide security. I do have a very healthy cash reserve, and so while it's never great to be with a loss of income unexpectedly, financially I knew I would be fine. Luckily for me, I was also able to pick up more shifts at my locums job, where I cover ophthalmology inpatient and emergency room consults for a local hospital. My husband often questioned why I took on this extra work when I always complained about taking call in the past. Having multiple streams of income can provide added security. In my case, when one stream of income was cut off, I was able to turn up another stream of income since I already had my foot in the door. I had taken on this locums position because it was something I could do during my weeks off when I was at home. And initially, the idea was that the income from that locum job could be infused into my coaching business. For now, I'll be working my locums job while figuring out my next step. There is a nationwide shortage of physicians, and I know there will be somewhere that can use my services. Ironically, where I currently live arguably does have a shortage of oculoplastic surgeons, but I have not yet found a work situation local to where I live, which has been preferable to those I found when I've been willing to travel. I've already spoken to multiple practices, many that came after posting in a physician Facebook group. I share this with you as an example of designing your work life. While what I do may not be your cup of tea, it may open your eyes to an increased range of what is possible. I've met many physicians, including women physicians, who have done locums work for all different reasons. There have been those that did locums work while they were getting their own private practice set up. There have been others who've done locums work while they were waiting out their non-compete after leaving one job before they can accept another in their local area. And there are others who really like the flexibility of choosing what weeks they work and what weeks they want to travel and have vacation or time off and enjoy going to different places to work. I personally don't have children, but I do know women physicians who have children who do make this work. The practice of medicine is changing, and I think physicians traveling has really become part of the current healthcare situation. If by chance you know a practice that could use a part-time oculoplastic surgeon, please connect us. You can always reach me by emailing growyourwealthymindset@gmail.com. Have a wonderful week, and depending on where you live, I hope you get a chance to enjoy some of autumn's beauty. If you enjoyed this episode, I would love it if you could share it with your friends and colleagues. And now for the disclaimer. I am not a certified financial planner, accountant, or attorney, and nothing I say should be construed as professional investment, tax, or legal advice. This show is primarily for your education and entertainment. I am a physician, but I'm probably not your physician, so if you need any medical advice, please contact your own physician. Thank you.